Certainly. Good evening to everyone. Thank you so much for joining us. My name is Kelvin Ampofo. I am the second district representative of the Omega Psi Phi Fraternity Incorporated. We certainly have a show in store for you on this evening. Again, during these times of COVID-19, on behalf of our Grand Bosses, Dr. David E. Marion, all the brothers of the second district, we certainly hope you and your families are well. Let me go ahead and introduce our distinguished panel. Certainly no stranger to those of us that have been here before. For those of you here for the first time, certainly again, welcome. Thank you so much for joining us. We're going to start off with Dr. Jedan Phillips. He is a physician from Stony Brook, New York. Dr. Phillips has been so instrumental in assisting this task force throughout this pandemic, and we're certainly pleasant and pleased to have him join us. Also, we have joining us is Dr. Keith Boykin. He is a retired pediatrician. He has so much wealth of information that he's going to be sharing with us tonight as it relates to pediatricians and the youth. And for tonight, certainly not least for tonight, Brother Wonzie Gardner. This brother has a touching story that's important and imperative for all of us to understand and so that we can relate to. But now I'm going to introduce our special guest of the evening. And certainly many of us are used to hearing from the brothers of Omega Psi Phi. And tonight we said we're going to start off just a little different. We're going to represent for the ladies. So all the way from Chi-Town, shout out to our brothers from the 10th District, all the way from Chi-Town. I'd like to introduce to everyone Dr. Kemberly Gibbs. She is an emergency room doctor, and certainly Dr. Gibbs, we certainly want to thank you for taking the time to share with us on this evening. And we'd like to start off with you, Dr. Gibbs. So if you would, just briefly introduce yourself. Tell us a little bit about your experience with this pandemic that we've been dealing with.
Good evening, gentlemen, and everyone that is joining tonight. As he stated, my name is Kemberly, Dr. Kemberly Briggs. I work in emergency medicine. I have a background also in nursing and public health. So I've been in the healthcare field for about 20 plus years. I want to thank the brothers of Omega Psi Phi for having me tonight to join your webinar. It's an honor to be amongst such a distinguished panel that is working and fighting to promote the awareness of COVID. I definitely want to share my experiences. And one of the first things I want to say is it's not possible for me to completely share everything, but I just want to kind of highlight, those things that are of most importance. First of all, since about the end of 2019, right when COVID kind of started, but we weren't really fully aware of it, is when I started working in the emergency room. At that time, we were seeing a lot of people that were sick, not really sure what was going on. Around March is when everyone started being more aware of it, and things got a little more serious. As far as working in the ER, we noticed that first of all, I was working in emergency and ICU. So COVID got it really, really in the thick of everything. We started seeing patients with severe respiratory issues. It got to the point where we were pretty much seeing patients faster than we could have room to have room for them to treat them. I wound up kind of working on patients in the ER, and kind of it was to the point where they were so sick coming in that I would be watching them in the ER kind of slowly fading and going to the point of death, and then having to turn around and go to the ICU and pronounce people dead. And at that time, we still weren't taking it as serious as it was. I think a lot of people still thought it was a hoax, and the emergency room and physicians in general were getting very afraid because people were not wearing masks. They weren't taking it serious. And we started losing a lot of our providers and healthcare practitioners. So you would come in and you would basically may have one or two nurses come in. You constantly had to re-educate people, the respiratory therapists, because they didn't want to give nebulizer treatments for the fear of catching it. That whole time was very, very serious. And death became a commonality. And you saw it so much day in and day out. I was working pretty much 14 to almost 23-hour days at that time. And that went on until about October. And right around that time, we started to see a decline in the number of cases that we had. So things got a little lax. We weren't as vigilant as we should have been, or we were in the past, with making sure that everyone was wearing their mask and doing those precautionary things. And then we started to see that new second wave come that everyone was talking about. And that presented itself with not so many respiratory issues, but mostly abdominal issues, diarrhea and things of that nature. So people weren't really seeing it as the second wave of COVID until it had gotten too late. And right around November is when I caught it myself. After working so many hours, of course, my immune system was already compromised. And on the 20th of November, I wound up testing positive. That brought on a whirlwind of events outside of just working in emergency medicine. First, of course, on the very next day after having it, I started having the GI symptoms with the acid and things like that, got really short of breath. Fortunately, I was able to stay at home and treat myself. I had a big fear of going to the hospital, knowing what I knew. There was many times in the hospital setting that I had to kind of turn people away just because of the virulence and the dangers of COVID and the possibility of them getting worse than what they came in. So I definitely didn't want to put myself in that situation. Started getting the shortness of breath. I was on a series of medications, vitamins and steroids and things like that. And those also bring their own complications. Then around like the middle of November, things got a lot worse. My post-COVID syndrome was a lot worse than me having COVID. During COVID, I kind of had the shortness of breath. I was using the nebulizer treatments, able to treat myself mostly at home, and pretty much got past that phase with the medications. After COVID was something totally different. It was like a whirlwind. I went through having gastritis, which basically the acids that were building up in my stomach, I could not get rid of. I literally had to purge, what I would call, I termed the nightly purge, just to be able to lay down at night because the acid was so bad I couldn't lay down. And then that started a roller coaster of other symptoms, gastroparesis, something that we normally see in diabetics, which basically your GI motility is gone. It's almost like a paralysis of your GI tract. So you're not really digesting things. That at the time I thought was just, something that was happening that was causing me not to sleep because of the discomfort. But I didn't realize until later that when those symptoms started to improve, I still wasn't sleeping. So around the 27th of November, I started with the insomnia that would not go away. It lasted for about 14 days. And then with the gastroparesis, I had a really bad abdominal distension. I almost looked like I was 7 months pregnant. And it was really, really uncomfortable and unbearable because it even affected my walk and just me being able to move around. Then the 1st of December, I remember one night just having this really bad pain in my leg. It undescribable pain. I have never felt any pain like that in my life. I was literally in bed screaming, and I'm pretty sure my neighbors was like, what is going on? But that was the only thing I could do to kind of relieve that. And it just got worse. Over the next 2 days, I noticed this rash that came on my legs, and it almost looked like vines were going up my legs, and it started to progress. And this was after I had that pain. Still have no idea what that is. And it's getting better, but it's still there today. Then the insomnia, of course, was still there, not being able to sleep. With that came a acute psychosis, a sleep deprivation psychosis. So I was seeing things, which was very, very different. I had never experienced anything like that before. I don't think I've even had a patient that has told me they weren't able to sleep for that long. I didn't realize you could actually function not sleeping that long. I was absolutely miserable, praying every night, God, please just let me sleep. And I was taking Benadryl and most over-the-counter medications and even some prescription drugs, still could not get to sleep. Melatonin was not helping. It was a very difficult time for me, just sitting up all night and just praying to sleep. And at that time, around the 15th of December, I remember they were still trying to call me to come back to work, because remember, we've lost so many practitioners. They didn't have anybody. So they were desperate. And, my symptoms started to subside. I still just wasn't sleeping. And I told them, if I could just get one night of sleep, I will try to come in. I did that on the 16th of December. And I remember walking around the ER trying to see patients, and my leg was killing me again. And my first thought was, check your leg, do an ultrasound. And you have to remember, because I'm a practitioner, I kind of have access to a lot of these things, but most people who aren't practicing, they would never be able to get all of this stuff done. So I asked, for an ultrasound, and now I have a clot in my leg. Is what we call a deep vein thrombosis. So I had to leave at that point and be put on blood thinners. I had injections daily and twice a day, actually, injections of Lovenox, which is a thinner that we use to manage your blood clots. And I was on that for about a week, but it was very depressing. I have put so many patients on different medications and never thought about the impact that it has on your psychological health. I couldn't do it anymore. I wanted, in the beginning, I was like, I'm not going on Eliquis. That's one of those meds that they do not have an antidote for. And, there's complications of bleeding. People get brain bleeds and things like that. So I was very afraid of going on that.
Wow.
But after doing those injections twice a day and then having to go to a lab once a week, bridging from that to Coumadin, which is another blood thinner that they transition you on, I couldn't do it anymore. And I went ahead and started on Eliquis. The day of Christmas, it's like things just kept going and kept going. The day of Christmas, I had a GI bleed, and I started with diarrhea like 2 days before that. Then I had a GI bleed. Now remember, this is past the 14 days of me being on COVID, on quarantine, past those 14 days of actually having COVID. I've tested negative at this point. I no longer have a positive test. These are all post-COVID symptoms.
Wow.
And I had a GI bleed those 2 days. I had diarrhea, for 2 days, and then wound up having a GI bleed. So I had to stop the Eliquis. Christmas Day, I was driving around Chicago trying to find a Protonix drip, and that's something that helps with your GI symptoms when you have a bleed, or that's what we treat it with. And again, scared to go to the hospital. As a practitioner and emergency room physician and work in the ICU, I'd seen too much.
Well, I tell you what, Dr. Briggs. So while you're right there, let's hold on to that. Certainly with that experience, simply amazing. So let's hold on to that. Dr. Phillips, I mean, obviously we have a sister here, Dr. Briggs. She's been through it. Certainly, please elaborate on your experiences. What would you like to share with everyone about this pandemic?
Well, first, I'd like to say, God bless you, Dr. Briggs. I'm glad you're better. Second thing I'd like to say is rest in power, 12, Tau Sigma, 1986, and 3, Alpha Gamma, 1990, 2 brothers who just passed that are in our fraternity from COVID. And unfortunately, that is a reminder to all of us how significant COVID still is. And unfortunately, those 2 brothers that had a whole lot of positive karma as far as the things they've done to uplift other people. And again, like Dr. Briggs out here trying to help, but in trying to help, unfortunately, putting yourself at risk. And I think the other thing that Dr. Briggs highlights is how impactful COVID can be, not just on your health in that moment, it can affect your health long-term as far as her still having symptoms. It also shows the wide array of areas that can be impacted. I know on the East Coast early in the year, we didn't see a whole lot of GI symptoms as a presenting symptom with COVID. I've seen some more recently, and actually Dr. Briggs' story has made me more noticing of that as a symptom. But I think what it speaks to is just the wide array of symptoms that can present and be COVID. So again, I think the important thing is if you think something's wrong, or if you think you did something wrong, go get tested. Because unfortunately, the other thing that can still happen is people can get exposed to it. And unfortunately, as I just stated, people are still dying from this. I think another part of it that is big is, unfortunately, this post-COVID long hauler syndrome issue, where as we get more information and see more people surviving, unfortunately, we're still seeing individuals' lives that are not clean and fresh and clear from COVID, but still heavily impacted because of the residual symptoms.
Fantastic. Thank you, Dr. Phillips. Now, we're just going to stick with the doctors. Dr. Boykin. So obviously, so many questions about kids. Also, obviously, our ladies that are, considering or otherwise carrying children. Talk to us from a pediatrician standpoint. What information would you like to uplift us about as it relates to this pandemic?
Certainly. I think I want to piggyback on Dr. Briggs and Dr. Phillips, because one of the things that may be different in children's presentation of COVID-19 disease would be just that, GI symptoms, diarrhea. And the other thing, in the younger children, babies, for example, they may not feed as well as other babies if they have the disease. So, we have to be pretty much vigilant on the children because they may have something that looks like a simple viral thing to everybody else, and they may indeed have COVID. They can have COVID and flu at the same time, and we suspect they have a viral disease, and a lot of people dismiss it and don't seek help. So, if your child has something that's out of the ordinary for you, don't ignore it. Go and have your child seen. The most important thing you can do for your child is have them, call your pediatrician. We have this great thing called telemedicine now that everybody should be taking advantage of. And the other thing I say to the parents is make sure you keep up your child's vaccinations, because that's going to be paramount to staying healthy during this time. We don't want to get a new set of some type of resistant disorder because we don't have our kids properly vaccinated. So, we don't have a vaccine for our children right now, unless you're 16 years and older. If you're 16 and above, certainly you can take the Pfizer vaccine. Otherwise, you have to be 18 and above for Moderna. And now, I suspect by this time next week, we'll be talking about the Johnson & Johnson vaccine, which is coming out. They're going to be meeting with the FDA on Friday to talk about that. But the other good news about that, if your child has had the flu vaccine and has something called the pneumovax vaccine, their severity, if they would get the COVID-19 disease, much less as if they weren't vaccinated at all. So something to seriously consider, having your child get the flu vaccine, and make sure the pneumovax vaccine, which is a routine vaccine that children should have, is on board. So if they would get COVID under the age of 16, then they have some protection that they wouldn't have otherwise.
Outstanding, Dr. Boykin, and certainly, Brother Gardner. Obviously, from your position as it relates, everyone always asks the question, well, what is the federal government, doing? Where are we at now? What's happening? Yeah. So certainly, please chime in, Brother Gardner.
Yes, Brother Info, before I do that, I'd like to compliment Dr. Briggs on what she just said, and it's so apropos. It seems like we hit me all the time at this point, because my daughter-in-law contracted COVID on January the 3rd of this year, and she has not returned back to work because of these things you're talking about, the after effects, the long haulers, whatever. Now, I was glad to hear that name, because Jessica has these migraines, these feelings of fatigue, and just can't get herself going. And the problem with this is that a lot of times when you go back to the workforce, where people don't recognize you're still struggling, you've been that person that has always been really strong. And it's hard for you when you've been that kind of person to recognize, hey, I can't do it. So I've got a grandson there. I've got her, my son's away a little bit, and just trying to be as a family to do that, and that pressure to put on there. So I commend you for what you were saying, how you doing, because these are real life issues that we're dealing with, and we're trying to give each other a roadmap to how to do this. So your story is our story, and it makes a connection. And to me, it's like, if this can happen to a doctor who is learning in the profession, who understands medicine and things we need to do, then the rest of us need to take heed to what you're saying and what's going on and how we're doing that. And so, Dr. Briggs, thank you very much for putting what I call that doctor personal spin on the tragedy that's happening to America right now. And with regards to the federal government, I think everyone's seen on the news the things that we're talking about, what we're trying to do. And as Dr. Boykin just alluded to, I think the Johnson vaccine will get the EUA. But here's what we're battling with the Johnson & Johnson vaccine. The efficacy rate, and doctors, please help me if I say this wrong, because I'm not a medical doctor, I don't want to get it wrong, is around 70 to 80%. And the efficacy rate of the Pfizer and the Moderna shots, we were told today in our meeting, was about 90, 95%. And here's what people are fussing about right now. They're saying, well, why are you going to give this to the urban or the rural areas, urban, Black, rural, poor, white Americans? Well, the answer is just very simply, the logistics tell behind this. If I can give you one shot, I don't have to put it into deep freeze. I can take it and store it for 3 months on the regular refrigerator. I've got to give you what you need. So the message we're going to try to pivot from my perspective now is this: take a shot. Whatever shot is available for you, take a shot. Because it's just like going to war. You want the best equipment you can get at that particular time. And I think, Brother Phillips, you said it best. How many times can you dodge a COVID bullet? So if you've not been vaccinated and someone's offering you a Johnson & Johnson vaccine, which they're going to roll out, and I think it's 3 to 4 million doses next week after they get EUA, and then they're hoping to get up to 20 million in the next couple of weeks, months. But the strategy that the Biden administration, I think, and if I can say that, the strategy looking at is trying to figure out where they can put that. And in our communities, we have what we call medical deserts, where there's no doctor's offices, no hospitals, there's not a CVS or Walgreens. They're actually medical deserts, just like I have a food desert. There are no grocery stores there. So we're trying to figure out how do we best serve that population. And the way you best serve that population is by giving them that one shot, and they get the shot and they've got the 70% coverage. Because here's the reason why, number two, if it's hard for you to get that first shot, just imagine trying to get that second shot, right? And so I want to put the spin on it like this way. This is not a racial incident. This is a logistics issue where we're trying to get to the most arms we possibly can. Now, what I will also say, Brother Amfofo, I think that we're going to have enough shots for everybody pretty soon. But the problem is, and once again here, is whether or not we'll take it. And if I can just get 2 more minutes, my hometown of Albany, Georgia, was on CNN the other night. Okay. And it's amazing how you see your hometown different on a screen than you do being a part of it. Number one, I didn't know how poor we were down there. Proud but poor. They set up a special tent down there for the citizens of Albany, Georgia. Don't register, because that was the epicenter in Georgia. Do you recognize they only got 15% of the people they thought they were going to get to come take shots? So they're making mass phone calls trying to get people to come take a shot, because that Pfizer vaccine had to be used a certain amount of time. And it was so tragic in my hometown. Over 400 people have died. People I know dying every day and can't get the message out. Hey, listen, this shot may not kill, it may not save you all the way, but it'll give you a fighting chance. So that's why we're doing these calls, trying to make sure everyone takes those shots. And thank you again, Dr. Briggs, for what you've said just thus far.
Certainly, we want to talk about all the different impacts that this pandemic has had. And certainly, Dr. Briggs, maybe just from, if we talk about economic standpoint, obviously some people are impacted because they're out of work, what have you. Share with us your thoughts on that as it relates to economics and this impact due to the pandemic. Just make sure you come off mute so we can all hear all the great things you're telling us.
One of the things I definitely experienced myself firsthand is once I was off work in November, I have not really gone back to work fully to date. So that's 3 months of lost income. And then you've got to think about, the insurance coverages and everyone trying to have access to populations that already have poor access to care. On the healthcare side, that puts a strain on not only the providers, it puts a strain on the patients. And then, with everyone trying to jumpstart the system and have everybody go back into work and everything, now we're compacting that because we're exposing people more. We're thankful that the vaccine is there now, and we're hoping more people are getting it so we can continue to see the decline in numbers. But that part of reintroducing everybody back to each other and back to the work scene and having the kids going back to school and things like that, that's causing an impact as well, because now we're causing more of a problem because people aren't vaccinated yet. And, you know, to go back to what Mr. Gardner said, I spoke to one of our senior VPs today, and we only have about 30% of our hospital employees that have gotten vaccinated because people are afraid. So you're putting these people back into the work system, and they're around each other. Some people still believe that they don't need to wear masks. And then some people aren't educated to the point where even if you have the vaccine, you still need to wear a mask. There's definitely people who have actually gotten COVID. So they have some antibodies and gotten it again. So, you know, even with the vaccine, that doesn't 100% guarantee you won't get it. It does decrease the risk of you being as ill or it being as virulent. So we're still promoting you to get it. But economically, having everyone return to the workforce, we're thinking that's great because, you know, now, you know, the economy is getting a little better, but we will see another surge if we're not careful.
This is powerful. I mean, this is powerful. A medical doctor. You're hearing it here first. The brothers of the 2nd District of Omega Psi Phi. We're bringing you this information. Dr. Briggs, thank you so much. Dr. Boykin. Dr. Briggs touched on something I know is near and dear to you. She talked about kids getting back to school. I think all of us, it's almost a year. In some cases, it's past a year that, you know, we've been home. We've not been able to go. The kids haven't been able to go to school. Talk to us, please, about kids and going back to school. Share with us your information.
Yeah, it's been a very interesting year for me. I'm sure Dr. Briggs can attest to the fact she's probably seen more adolescents in her ER with psychological problems and depression and things like that. And we know it's very, very important for children to get back to school for these the younger children, that is, for this development and socialization that they so desperately need. And we can't forget our adolescents. They need that socialization themselves. They need to belong to their peer groups and so forth and things like that. That's why you're seeing an increase in the suicide rate and the depression and all those things that you're seeing. Mm-hmm. Now, interestingly enough, it varied in my own personal experience. It varied with me because my wife is a principal of a private school, and she deals with the younger age children, and they went back to school in August, face to face. But their mitigating circumstances that they did, and they did very well. And that is, they checked all of these children. They had special ins and outs, how to get into the school and out. And they made sure all the children had masks. And when the children, even the younger children that could wear the mask, because under the age of 2, you can forget about a child wearing a mask. But they don't have kids that young in her preschool right now. But the kids that were old enough to wear a mask, they brought the mask in, and they always had a spare mask. And at different times for different kids going to different places and hand washing stations and things like that. They had a certain flow where they would come through. The parents would put them off. No one was allowed in the building unless they had a business in there, if they were a teacher or whatever. So they did pretty good. But despite all those things, you still could have COVID. You know, you can bring it from other districts into the school through athletics and things like that. So there were times where they had to shut down their school for an in-learning day. But for the most part, they did. Now, here's the interesting thing about school. We certainly can get the kids back to school because, you know, evidence is clearly showing more and more that the children are not the major spreaders of COVID in the school. It's the personnel, the teachers, educators. You have educator to educator spread. You have educator to student spread, ultimately. So the thing is, we really need to get the teachers vaccinated. If we get the teachers vaccinated, we can cut down in COVID-19 in the school system. You know, because, you know, right now the children don't have a vaccine, but also for our children's mental health and our children's well-being, I can't stress enough the fact that we need to get these kids back to school as best we can. And there are 5 mitigating things we have to do. Proper use of the mask, not wearing under your nose, proper use of the mask, okay? Washing your hands, watching your distance. I want to say them here because I don't want to forget them. Cleaning and maintaining a healthy facility. You got to clean down these surfaces because you know children, they're going to wipe their nose, wipe your hand on the surface like that. And then a rapid contact tracing. If you have a child that breaks out, you have a positive COVID test, then you got to get on it right away. You can't wait. You can't decline because that impacts the whole school. And you have to do it in conjunction with your local health department. And you also need to know what's going on in the community. But we have to get these kids back. And the AAP is certainly on board with getting them back as well, as long as it's healthy. And the President's Task Force also wants to get the kids back, but in a very safe and healthy manner.
Outstanding. Dr. Phillips, go ahead, come off mute. Dr. Phillips, we have what I think we would call COVID fatigue. And we are ready. We are ready to get out of the house. We are ready to go socialize. We are ready to go. In our case of the fraternity brothers, we're ready to go hang out. I think everybody is ready. Can you remind us what we need to be doing, what we need to be thinking about as we continue this pandemic?
What I would say is rest in power 1286 Tau Sigma and rest in power 3 Alpha Gamma 1990. Two young brothers. Brother from Alpha Gamma was a high school instructor, a track coach, so obviously a pillar of his community. And again, brothers know 1286 far and wide. So what I would say to you, not saying that they weren't being careful, but it is still out here. The other thing that we have to be mindful of are these variants, which are now seen in a majority of the states in the United States right now. And these variants are highly infectious. So again, the risk is out there, the chance that even if you are doing the right thing, that you still could be exposed. And unfortunately, to your point, the fatigue puts us in position where people want to take chances. Again, social media, we be snitching on ourselves. You seeing pictures of people together, and you know they don't live in the same house. You know they don't live in the same state, but at the end of the day, we praying that they get through that moment. But unfortunately, we still got a lot more time to go, y'all. We are not at a point where we can take our foot off the gas. Again, we have two brothers that should not be dying in 2021 that are not here anymore. And that's just our fraternity brothers, not including other people, because again, we still dying at a higher rate than our Caucasian counterparts. We are still, unfortunately, not being vaccinated at the same rate as our Caucasian counterparts. You look at our kids need to be in school because, again, we also deal with social determinants. Not all of us got dependable Wi-Fi in the crib. Not all of us got access to quality food sources in the crib. So again, us getting back to normal life, as I mentioned already, the death is there. But the other part of it, and Dr. Boykin will attest being a pediatrician, is the disabling of our young people. Because you're right, the lack of socialization, the lack of normal development, it is not happening. And unfortunately, you are finding children that are more and more not able to socially engage. And these are part of regular, I'm on the admissions committee at Stony Brook. And, again, I'm doing medical school admissions interviews regularly. And part of that is examining your ability to communicate with other people. Are our kids going to be ready for that moment if it presents to them? So again, I think, as I've said on multiple occasions before, what did Gandhi say? If there's a future you would like to see, then you got to be it. So we have got to show the modeling of protective measures. We have got to show our young people that, again, they got to wear masks too. As it was stated earlier, they may not get sick from COVID, but outside of the school system, what they can do, or outside of school, they can spread COVID. So again, imagine you dependent on that elder in your household. And unfortunately, because you coming and going, you expose your elder who takes care of everything. And now that person is disabled and not able to help you out. And you know what's happening in the springtime? Kids are applying to college. They're thinking about what the next step of their life is. And this has already thrown a major wrench in that, but it can throw one wrench that you can't repair if we allow the ones that help us, that nurture us, that take care of us to be detrimentally harmed by this. So again, I still think that the fatigue is something that we got to deal with. But as we've said before, we've also got to be intentional with our mental wellness and spiritual well-being. So we've got to be about, what am I doing to keep myself in a positive space, even in light of it being a pandemic?
Powerful. one of the things that President Biden has already done, he's asked that the flags be flown at half staff for the simple fact that over 500,000 people, over 500,000 people have lost their lives to this unfortunate pandemic. And so what I'd like to ask, and I'll start with you, Brother Gardner. Obviously, we know that we need to do our best to educate people and basically make sure people consider taking the vaccine. What would you like to share, Brother Gardner, about taking the vaccine?
Brother DR, to me, this thing is personal. You guys have heard my story. I had 3 people that died last year, and it impacted me. And I was trying to find a way to channel the loss. Didn't realize or recognize how important. Well, let me back up. I know how important mom and dad, my daughter, were to me, but I didn't know the day-to-day thing until they're no longer here. And there's an emptiness inside of my life now because my mom and dad are gone, which is normal. They're supposed to go. Mom died, COVID-related pneumonia. Dad died a little early. Then my daughter died. And at 28, you're not supposed to die in the normal course of things. You're not supposed to do that. So I'm dealing with that. And so I have tried to find a way to let people know how impactful this thing was when it first started. I was like crying chicken George, hey, the sky's falling, not knowing where we're going, but we're at this point now. And I had to find some kind of way to do something very proactive about this situation. You either be part of the problem, part of the solution. So I chose with the former DR Sherman Charles, Shorty Bang Bang, and our former bosses, Brother Reggie, and we decided to have this form within inside of this LGG, and it kind of grew. And Dr. Boykin came on, Brother Phillips, and we became a part of something. We were just trying to tell somebody. And I'm of the firm belief that if you can just reach one somebody and get them to change their mind, and that one somebody can go to somebody else, individual by individual, brother by brother, sister by sister, and say, look, you need to take the shot. Last night I had an experience with a couple who had already had COVID. My wife let me out of the house about 30 minutes to go visit Brother Jackson, and leaving there, I met this couple and we sat and talked about it. They were going to take the shot, and not being a non-doctor, but being working at the Science Foundation, I was able to articulate them some of the reasons why they should take it, and they were afraid to take the shot. And after about an hour and a half discourses talking about life and different things we've all gone through, and they had lost a child early on through a fire and everything. And we began to discuss this about why it's so important. And the message I'm trying to bring home is this, that this is not some grand thing that we can do, but it's individual by individual. It's session by session, mentor by mentor. It's conversation by conversation. Because we're always talking about we don't have access. We're always talking about we don't have an opportunity. But this time we've got access. This time we've got opportunity. It's not the best. We've always been on the back of the bus. We've always been the last to get something. But this time we have people like these brothers and doctors on these esteemed doctors on this panel, others out there in our community that are trying to make a difference, trying to make a change. And what hurts me the most, Brother DR, is this. I can take it when someone has a logical reason. They're trying to search for information, or they've got some pre-existing conditions or whatever, and they say, I'm waiting for more. I can deal with that. But what I cannot deal with, and this is a fault of my own, I can't deal with ignorance. When someone's trying to give you some information, trying to enlighten you, to give you some uplift and telling you what you need to do, what you should do, and you just completely disregard it because of something you heard on television by a comedian or by an actor who doesn't know they're doing their job to make you laugh. Well, this is not a laughing matter.
Talk to him. COVID
is not a laughing matter. When you go home and you can't visit your mother because she's dying and she's in the hospital, the only way you can talk through is through Zoom. That's not a laughing matter. When you have a daughter that dies because she couldn't get to a hospital, that's not a laughing matter. When you see friends who are dying, dropping dead because they couldn't do this because of our past history, that's not a laughing matter. It's not anything to be joking about. So to me, this has become a passion for me to try to reach people at the point of their needs, not where I'm at, but where they are, because we're all at different places in our lives. And what we've got to do, we've got to reach people at the point of their needs, at the intersection of need and desire. We need to make people desirous of this shot. I mean, I get up every morning exhausted trying to register people that I know, older people, for the shot, trying to talk to my friends about the shot. My friend said, here comes Wonzie, he's going to be talking about the shot, because I am. Because I don't want anyone to feel what I'm feeling right now. I don't want anyone to carry the burden I'm feeling right now, because it's not going to change. My daughter's never coming back. My mama's never coming back. And I don't want anyone to feel that. If I could have just held my mom in my arms and said, Mama, go home to glory, that's one thing. But not be able to touch her because she's got a disease that man does not understand. I can't wrap my hands around it, bros. I just can't wrap my hands around it. And that's what drives me to be on these calls every week. That's what drives me to talk about this. This is what drives me when people say, Wonzie, shut up. It drives me to say we can do better than this. We're better than this. And we've got to be better than this, my brothers.
It's powerful. Powerful. Dr. Boykin, what do you want to say? What do you want to share as it relates to this vaccine? Somebody's on the fence. I mean, what are the facts? What do you want to share about the importance of taking this vaccine?
Well, thank you, Brother Dare. It's very, very important. I mean, never, as Brother Gardner said, never before have we had the opportunity to be on the front end of receiving a vaccine. And all the people out there say they don't want to take the vaccine. Well, it's as simple as this. As he also said, how long you can keep dodging that COVID-19 bullet before it hits you? Because it's not a matter of if, it's a matter of when. And if you vaccinate, at least you have a fighting chance over everything else. Now, one thing that people have to understand, this wasn't a vaccine that was rolled out to the non communities of color, because in each of the studies they had about 10% African Americans in both the Pfizer and the Moderna studies. So we had people out there that took the vaccine for us, and we had the National Medical Association looking at these vaccines, make sure that there wasn't going to be any more untoward effects in communities of color, and they looked at the facts and they approved it. And the NMA is an organization for African American physicians. So if they can vet the vaccine, I don't know why anybody else would go out and say all these stupid things about it, because it's not a vaccine to kill Black people. If it was a vaccine to kill Black people, why are all the non-Blacks and people of other persuasion jumping the line and getting the vaccine? You can't separate that out. You have to be very, very sophisticated to separate the vaccine out. We'll kill off the Black folks and we'll keep the white folks one way. This is the same vaccine. Everybody's taking it. And people know that this is a devastation. This is not a hoax, that this disease is a killer. And if you get the vaccine, at least you have a fighting chance. Yeah. And you so much of a fighting chance that the American Academy of Pediatrics is saying every adolescent that is eligible should get for the vaccine should be allowed to get the vaccine. Pfizer and Moderna have studies going on for the ages of 12 to 17 to get the vaccine out in children. And AstraZeneca over in England has 6 to 17-year-olds in their study. So we just got to get more people involved. And eventually, it's probably going to be next year sometime, children will get vaccinated. But the vaccine is going to help cut out this whole transmission of the virus. And if we can get enough people vaccinated now, we can put these variants at bay as well. Because if you can't transmit, you can't mutate. So the vaccine is very, very important in that aspect.
Dr. Phillips, they don't know what to do. They're hearing all this stuff about the vaccine. Should they take it? Should they talk to us about the vaccine, Dr. Phillips?
Well, I think the first thing that I've, because I'm a pretty intense guy, I have erred on the side of, being very passionate in my expression and in my listening when I have been confronted with individuals with misinformation. But what I realize also is people have good reason to be hesitant. They have good reason to be doubtful. Unfortunately, we have a historical issue in America where we have not been treated well. So I think as you go to people with this discussion, you got to be empathetic and compassionate to where they're coming from. As I've told the bros before, I mean, if you make a choice, that you got to hold that. And I think part of that is also respecting someone's choice if they unfortunately don't want to follow the right thing. Because I'll tell you this, one of the best things that has been happening for me, and I'm sure Dr. Briggs can attest to this, the fatigue that occurs when you are going in day to day. You can't take no vacation right now. You don't get days off. Every day you may get a day off. The people are calling you to come in when you get off of work because you were the person in that village growing up. Everybody from that village and their peoples is calling you with a request or a question. So again, when I get them a lot now, and I really appreciate them, bruhs sending me text messages with their picture getting the vaccine. Dog, I'm getting the vaccine tomorrow. I made my appointment. You know, for each time I get one of them, that makes me feel good. Because again, I realize how difficult it is. You are seeing a low amount of us getting vaccinated, and some of it is because of access. But unfortunately, a lot of it is also because of us saying that we do not want to get the vaccine. And the individuals that are in that group are also your medical and health professionals. So these are also people that are educators, not people that have no education. So again, we can't just stupid them down, you know? So what I try to do is I try to be as empathetic and compassionate to that. I think you've got to bring it to the people. Part of that is the messaging. That's why Dr. Briggs is there, because we felt that she is able to communicate a position and experience in this COVID that people can relate to, because they can relate to her. Same thing with each of us. Again, we've got to make sure we have messengers that our community trusts. You can't just show up, you know, on the corner and say, I'm giving out vaccines and we don't trust you. We're going to keep walking by that. We've got to also make sure that when we're talking about this, we've got to make sure that we use language that is understandable. You know, one of the things that I try to do is I try to keep it as simple as possible, because I've always said, if you are the smart person in the room, you have the ability and the skill set to adjust the frequency of what you're communicating to that of your audience. Last but not least, we got to stay vigilant. As it was mentioned earlier, you know, we got to make sure we continue to wear our masks, wash our hands, wipe down surfaces, watch out for unsafe situations. You know, again, I'll say it again, a majority of the cases now are coming from unsafe social gatherings, at least in the state of New York. So again, y'all, when we're fatigued, when we're saying, you know what, I'm gonna just do it this one time, that could be the last time. So again, with this new weapon, with this new tool that we have available to us to change what's happening. And let's look at what's happened over the past month. The number of hospitalizations have gone down. The number of deaths have gone down. We've gotten back to the numbers that we had pre-Thanksgiving now, even though those numbers were worse than what it was at the beginning of the year, but it's still better than what we've experienced. And why is that? It's because we've got leadership and modeling of masking, and more people are wearing masks, more people trying to be diligent about avoiding unsafe situations and practicing those safety measures. But another aspect of it that we can't negate is the effect of the vaccine. And we're starting to see with the numbers, even though it may not be felt as far as how we're living, that is something that we all understand process here. And again, you can't just go from A to Z. You got to go through B, C, D. And unfortunately, part of that process is us having the fortitude and perseverance to maintain that vigilance. So again, we got to, you know, continue to protect ourselves. I would say get the mask or get the vaccine. But again, I know people got their choices. My thing is, if you're going to jump out of line for some legitimate information. Don't jump out of line for Dr. YouTube or Dr. Facebook, you know. And then when you recognize those folks from that suburban, well-to-do community, they just took your spot. And they're not going to give your spot back up to you. So then you're going to have to wait till we get to the back of the line. So the last thing that I would say, and it was said before, whatever vaccine you get is the right vaccine. More people are going to get Johnson & Johnson. Now, again, 70 to 75%, you may say, well, that's not as good as 90%. But that's about what we see with the annual flu shot that we get, and we accept it so readily. So again, that is still good protection against COVID. So with that being said, it will be a shot that's more available because of the refrigeration, things that it does not require, unlike Pfizer, because of the fact that it's one shot and not two. So again, there are new things to put in the tool belt to give you some defense and some ability to fight off this COVID. But the key part is making sure you take advantage of it. Thank you very much.
Outstanding, Dr. Phillips. And I think, at least from what I'm hearing, I'm sure we've all been hearing, I think there's a different refrigeration, so it's not as critical with the Johnson & Johnson. So that's powerful. Dr. Briggs, your message to everyone about the vaccine, please. Don't forget to come off mute so we can hear all the great things you're saying.
So as Dr. Phillips was speaking, one of the things that kind of resounded with me and everyone getting the vaccine is I think sometimes people think that there's always going to be resources there. There's always going to be something that they can do if they get sick. So it doesn't seem as real until it hits your house. As Brother Wonzie was sharing his story, that's very, very real. And we have to understand that during that whole time that I was, serving people in the ER and trying to make sure, that we had the staff, one of the thoughts that came to mind is they're going to get to these ER doors and the lights are going to be off. You have to remember that your healthcare practitioners are human as well. Just as, everyone else can get it, we are just as able to get it. I got it. And we're losing people. We're not just losing people on, the patient side. We're losing people on the side of being able to care. We lost one of our members as well for the Chicago Fire Department. Known him for years. Great person. We got around the same time. He didn't make it. Gratefully, I did. But the vaccine is so important. And just as Dr. Phillips was sharing, I think our message has to also be understanding, where everyone is coming from and their reluctance or their apprehensions in getting the vaccine. And then not only discussing that with them, but asking that simple question as to why. What are your fears? What is keeping you from doing it? And, a lot of, like, for example, people were saying, well, that's something that they're trying to do to kill us off. They want to kill you off. They could have did it with the flu vaccine or any other medication that, diabetes medications that they say they only give to Black people. They can kill you in so many different ways. Everyone has been getting this, and well, not everyone, excuse me, but other cultures have been getting this vaccine. And you look at the data and everything that's happened, you have not had any, besides the one that happened in Florida, and that was a Caucasian male, you haven't had anything that detrimental to happen. And if we're not going to get this vaccine, you have to remember viruses do mutate, viruses do change. You do not want another surge. And you do not want to get to that point, like I said, where you are coming to that ER and you're thinking you're going to get help and the lights are off.
Thank you so much, Dr. Briggs. So here we are. We're getting ready to, unfortunately, as always, great panel. This always happens. We always get close to running out of time. I'm going to ask this, Brother Gardner. How do we get back to before COVID-19? I don't want to say back to normal. I think different people have different views on what's normal. How do we get back to pre-COVID in these next months coming up, Brother Gardner? Don't forget to come off mute, Brother Gardner, so we can hear all the good information you'll tell us.
Right. That's a very interesting question that we have been posed to a lot of social ethicists right now. We will never go back to where we were before because this has been so traumatic to the American and the global psyche that people never go back. We were in a thought piece the other day where they were talking about even after this is over, people are going to be reticent to give up masks. You will see more mask wearing on trains, planes, and buses, like they do in Asia right now. They do that quite a bit. And so, what we're trying to construct, what is the new normal going to look like, and what is it going to be about? Well, the good thing about it, I think this pandemic is showing us the medical inequality in America, and this pandemic is showing us that medicine and the lack of access to medicine affects and impacts us all. Because this will not be the last time. I'm not a predictor of the future, but this will not be the last time something of this type will surge forward. Because as we become more globally connected and globally dependent, what happens in Asia, what happens in Europe is going to happen here eventually. The tides of time have shortened. And so what we need to do is as a country, the first thing I would love to see, if I could live in a panacea and build it myself, would have a country that was void of politics when it came to medicine, and let the science and the data speak for itself, regardless of your political persuasion. Let it speak. I was watching last night in one of those times I couldn't sleep because I was in a semi-depression, thinking about life and everything. and they were saying that 84% of the people that died didn't have to die. I don't know what that number is, 84% of 500,000. That's a big number. So then I get mad because I say, well, I know my mom's going to eventually die, but she didn't have to die that way. You know what I mean? And so we've got to try as a country, as a society, to get a place where all human life is valued, regardless of social economic class. And certain things are unalienable in the sense that you have the right to, let's say, life, liberty, and pursuit of happiness. I say you have the right to go to the doctor. You have the right to a good meal every day. You have a right to fair housing. So when we start talking about this progressive right, left, and the ultra right, I think if people would tone down the rhetoric a little bit, everybody wants to make sure their children are safe. Everybody wants a roof over their head. Everybody wants to have a job they can go to and have a hope for tomorrow. And I think we need to lower the rhetoric on all sides of issues, and even this one, okay, and talk about what is good for the common good. I always tell people, if you go back to the preamble, it goes like, it says, we the people, in order to perform a more perfect union, and establish justice and provide for the common defense and promote the general welfare. If you stop just right there, that's what we should all be about, what we're trying to do. And so my hope, my prayer is that after we get to the other side of this pandemic, that we will do a lessons learned, what was good and what was bad. I think Brother Dr. Phillips mentioned earlier, when leadership changes at the top and you see leadership wearing masks and putting out masks to the community and saying we're going to give people shots and no insurance card, that's a signal. That's a signal to me in the right direction, because this virus is not a respecter of race or person. It attacks everybody. Now, we're concerned about our people, which we should, but we're concerned about the greater community writ large for everybody. And so my hope is we get to a point where we can talk about medical and scientific things, nonpartisan, and do the right thing at the right time for the right reason for everybody.
Thank you so much, Brother Gardner. Dr. Boykin, your closing remarks.
Well, I just say to everybody, and I can't stress this enough, the 3 W's: wear your mask, wash your hands, wash your distance. If you don't want to get the vaccine, at least double masking, you have a 95% chance of decreasing the transmissibility of the virus in and of itself. Okay? So if you do get vaccinated, you're not going to be a panic on that you're not going to get the disease at all. You still can get the disease. It just might, if you get the vaccine, you just won't have it as bad as you might have if had you not been vaccinated. You still need to wear your mask after doing that, and you should not travel. And don't consider yourself, I can go out and do whatever I want to do because I've had the vaccine. You leave for 14 days after your second one. If you have the 2-dose schedule, you're still not going to be any better off than if you didn't get the vaccine at all. So, wear your mask, wash your hands, watch your distance, and be in good aerated spaces. Closed spaces are not good. Open aerated spaces are better. So I want to leave everybody with that one.
Thank you so much, Dr. Boykin. Dr. Phillips, your closing remarks.
Well, I think just echoing what everybody said earlier, which is can't get tired, y'all. We got to still be vigilant. For the foreseeable future, wear masks. Make that part of your script. Me and the bros, we used to stay back in the day when things would happen in the day when we hung out. We would just make it part of the script for the day. So you got to write the mask into your script and don't let it get in the way. Because again, dying from COVID, getting sick from COVID, and as we've seen, it's not just about living, because you could get COVID and end up with long hauler symptoms. And that can be equally as impactful, as they showed on a recent Real Sports HBO, where they had a college track star, a WNBA player, and a professional athlete. And all 3 of them had COVID, and they're in their 20s and can no longer perform. So again, there's a lot of unpredictability, with this. And to the people that are holistic and believe in wellness and immunoboosting, it doesn't have to be one or the other, because again, I do agree with that mentality and that practice, but you can't just say, I'm going to start living right and eating right starting in November, and I'm going to be protected from COVID now. So that might be your long game, but in the short term, as Dr. Boykin said and Dr. Briggs said and Brother Gardner said, we got to practice those safety measures. And as we've done, not Dr. Briggs yet, but the rest of us, once she's able, she will. We've gotten vaccinated to add to the protection, because you know what vaccination does? It allows me to still go to work at a vaccine site for our seniors in our community and reassure them that they're doing the right thing. So I'm not sitting there scared because I'm scared to come up on anybody. Not saying I don't have my mask on. It allows me to function with a little confidence. And that is part of the getting back to where we were before. But it's not going to happen overnight. And I think we still got to be prepared to look and walk this path a little bit longer. But again, I do believe that there is going to be good days in front of us as long as we do our part. So with that, I thank you for the time, my brother.
Thank you so much, Dr. Phillips. Dr. Briggs, your closing remarks. Again, thank you so much, but don't forget to come off mute and your closing remarks.
As everyone has already echoed, it's so important that we realize that this is not the end. We're not ending with the vaccine. It's not a cure-all. It's something that is definitely going to help, but we still have to be very, very vigilant and making sure that we do what we need to do. The 3 W's, as Dr. Boykin mentioned earlier, definitely important. We've got to be wearing our masks. We've got to be, washing our hands and watching where we are and watching those close spaces. It's so many things that can happen with COVID. I didn't share earlier, but, I've got a clot in my lung and still on Eliquis and so many different things and still get very, very fatigued and tired just trying to go back to work. And I've already been called and asked, could I come now because somebody's not there? So we have to be vigilant for ourselves, for our family members, for our community. It's not just about one person at this point. It is definitely like Brother Wonzie shared, for the general good of all. So the take home message is definitely continue to be vigilant, continue to wear your mask, to continue to be careful of your surroundings. Do not involve yourself in these super spreading events. And, we've got to watch out for each other.
Simply outstanding. Well, to all the guests that have joined us on tonight, I hope you've had a wonderful evening. Once again, on behalf of our Grand Bossless, Dr. David E. Marion, and on behalf of all of the brothers of the 2nd District, for our guests, the 2nd District is comprised of the states of New York, New Jersey, Pennsylvania, Delaware, and Maryland, which is comprised of about 5,000 brothers that reside in those states that are active doing the things for Omega. Certainly to the brothers of Lambda Gamma Gamma chapter and Dr. Vance, who leads this task force. Our brothers behind the scenes, Brother Worley, Brother Ali, and certainly Brother Piercy, as well as Brother Ed Hill. We thank all of you for tuning in. We thank all of you for your support. We're here on the last Wednesday of every month. For the brothers, if you're financial, you have an opportunity to get this information every week in the brothers session. So please contact a local chapter in your area. Otherwise, for everyone, we're here on the last Wednesday of every month. Until then, continue to stay safe and stay well. Brother Kelvin and Pofo. Thank you.